Hi, this is Dr. Ann Peters, the Director of the Clinical Diabetes Programs at the University of Southern California, and today I'm going to talk about the long-term follow-up results from the United Kingdom Prospective Diabetes Study. Now, I think this study gave us some really great news. We, as diabetologists, have been having sort of a spell of negativity with ACCORD and ADVANCE, which weren't terrible results, but nonetheless not that inspiring. Now we have the long-term results from the UKPDS study, a study done in a different population that actually shows a great deal of benefit. So what is the UKPDS study? The UKPDS study was a study that was started in 1977, and it was done primarily in the United Kingdom. It involved 5,000 or so patients with new onset type 2 diabetes, and they were randomized into one of two groups, conventional treatment or intensive treatment. The drugs they used were the drugs they had available at the time: metformin, sulfonylurea agents, and/or insulin, and of course lifestyle. At the end of the trial, the results showed that there was a significant reduction in microvascular complications between the two groups, but that although there was a trend to a lower rate of macrovascular events, this did not reach statistical significance. The A1C levels achieved in those two groups weren't all that different. It was a median A1C of 7% in the intensively treated group compared to a median A1C of 7.9% in the conventionally treated group of patients. After that study ended, the patients were followed for the next 10 years. Now, not in a study environment, the A1C levels after a year basically converged, and everybody's hemoglobin A1C level was pretty much the same. But after 10 years, what the investigators found was that not only did the reduction in microvascular complications stay over time, it was maintained, but now there's a reduction in myocardial infarction as well as in overall death. So to me, this is very significant. Now, why do I think this was different from the other studies? Well, this was a study in patients with new onset disease. They were about a decade younger, and very few had existing macrovascular disease. So my conclusion from this is that it is incredibly important to treat patients early in the course of their type 2 diabetes, to treat them as aggressively as possible without causing unacceptable rates of hypoglycemia, to lower their A1C levels to a range that is as safe as possible and as close to normal as we can. And it's also obviously very important to use cardiovascular medications to lower blood pressure, cholesterol, and do the other things we do to lower the overall risk for both micro and macrovascular events. I'm Dr. Ann Peters for Medscape.